Good morning everyone. Welcome to All Force e-learning classes. Chapter 2, Session 13. Now we discuss the respiratory disorders. Respiratory disorders. Respiratory system or disorders. What now we'll discuss? Disorders. That is, the disorders include related to the respiratory system: difficulty in breathing, cough, wheezing, and feeling sickness. These are all what the symptoms are we see in the case of the respiratory system disorder. Respiration is exchange of gases, so one fails to breathe continuously. One faces difficulty in the breathing is all what the respiratory system disorders. Generally, the disorders we see as the chronic and the acute. Chronic and acute. Let's see what is this chronic and acute condition. Chronic in the sense the disorder or the problem that one faces for a long period. The long period disorder can be long period. A disorder that one suffers for a long period is said to be the chronic. And it is not severe and it is not severe. That is, one suffer for a long period. For suppose, asthma is said to be asthma. Example, asthma is what we see a person suffer for a long period. The severity is not more. It can be overcome by treatment or avoiding the allergens that they face which cause the disorder, and it lasts for a long period. Whereas the acute disorders are the disorders that are for a short period of time. Short period of the time, what the acute disorder, and this is a severe. That is, for a short period the disorders are seen and it may even lead to the fatal acute condition here. So that is a general term I used. For suppose in certain conditions the hepatitis, however this is not related to here as we have discussed here. I am saying acute is in one of the hepatitis disorders, hepatitis A, B, likewise many types are there, in which one of the hepatitis condition, that is the jaundice, which is severe, within a short period of time the severity increases and it leads to the fatal. So the chronic disorders in the sense the disorders that one face for long period disorders are chronic disorder, whereas short period of time the disorders are said to be the acute. And the chronic disorders are not severe, whereas acute is severe. Now under the respiratory system disorders, we'll go for the discussion of the different types of the disorders, where we came across the chronic obstructive lung or pulmonary disorders and the occupational respiratory disorders. The respiratory system disorders now we'll discuss under the two heading: chronic obstructive pulmonary disorder, COPDs. Next, occupational respiratory disorders. This is the second one. I repeat, COPDs in the sense the chronic obstructive pulmonary disorders, or else the respiratory disorders or lung disorders. In this connection, this is occupational respiratory disorders is what now we'll see. So first of all, let us let us know what the COPDs, chronic obstructive pulmonary disorder, and occupational respiratory disorders. This is for a long period, and this may be due to infections, this may be due to the inhalation of antigens, dust particles, whereas this is the occupation in the sense the working place of an individual is an occupation. Occupational respiratory disorders include, there are many workers work at different industries, that is in the chronic obstructive pulmonary disorders, occupational respiratory disorders. This refers to, this is for a long period. Asthma is and the bronchitis, bronchial asthma, emphysema, and bronchitis comes under the COPDs, chronic obstructive pulmonary disorders. Whereas the occupational respiratory disorders, there we discuss the respiratory disorders that one faces at the working places. There are many workers who work at different industries, asbestos industries, silica industries, cotton mills, grinding of the stones, quarries. These are all various the industries where people work. So people are working at such industry have the assessment or else prone for the disorders, since it is a working places. So we treat it as occupational respiratory disorders. Under this condition, now we'll discuss what are COPDs. What are COPDs? Chronic obstructive the pulmonary disorders. In this connection, first of all, we'll discuss the asthma, bronchial asthma. 2, the bronchitis and also emphysema, and the third one is bronchitis. So besides that, there are many other respiratory disorders are there that comes under other category, which means they are generally happen to take place. For suppose pneumonia is there, even a diphtheria, even the tuberculosis, SARS. These are also the other diseases, disorders related to the respiratory system. But under category that we'll see right now, chronic obstructive pulmonary disorders are for a long term, the disorders that one prone for the long period. That includes the asthma, emphysema, bronchitis. Asthma is one of the chronic obstructive pulmonary disorder due to inflammation in the bronchi and bronchioles is what name it to be the asthma. Inflammation means sense of fire. Inflammation, I repeat, inflammation, inflammation, inflammation. That is nothing but the sense of the condition of the fire that is one prone for inflammation. Inflammation in the bronchi and bronchioles is asthma. Now the question is, why the inflammation of bronchi and bronchioles takes place? It is due to the spasm of sustained contraction of smooth muscles associated with the respiratory tract, what we name it as the asthma. So, What I said is the asthma is a condition which is due to the inflammation in the bronchi and bronchioles, due to the spasm in the sense the sustained contraction of smooth muscles of the respiratory tract make the bronchi and bronchiole narrow such that one faces the problem, name it to be the asthma. The symptoms include the difficulty in breathing, coughing, continuous cough. Next, difficulty in breathing. Next, we also see wheezing in the sense while difficulty in breathing, whistle sound is seen is what name it to be the wheezing. Apart from that, the asthma is also caused due to the narrowing of the respiratory tract due to the inflammatory substances, name it to be the histamine. In that sense, it is said to be the allergy. You might have noticed that certain times you might have been to your own places, that is your parental places, where you might have suffered from the sneezing, snorting, cough. When you resume to your own places, when you come back to your place, you resume a normal condition. Why? It is nothing but exposure to the allergens. Here, allergens in the sense, allergens means the pollutants, or else the one that stimulate the production of, or else the external factors. Allergens, we can say the external factors once enter into the body stimulate our immune system to respond. That is one of the allergies. We see such condition which is also named to be the hypersensitivity or exaggerated immune responses. So, asthma, it is a chronic obstructive pulmonary disorder. Asthma is due to the inflammation in the bronchi and the bronchioles caused due to the spasm of the bronchi and bronchiole. Spasm in the sense the sustained contraction of smooth muscles makes the respiratory tract narrow. When it becomes narrow is that one experience the continuous breathing? No. Difficulty in breathing. Cough is nothing but the what is called disturbance in the production of the, that is sending our air outside. So cough, difficulty in breathing, wheezing in the sense of the whistle-like sound. The symptoms of the asthma is a difficulty in breathing, cough and wheezing. It is also caused due to the exposure to the histamine. Histamine is one of the inflammatory factors produced from mast cells. Recall your memory. Earlier in the first year, under the health and disease chapter, we have discussed that the allergies are due to the inflammation is also caused as one of the symptoms. Inflammatory mediators are bradykinin, histamine, and the anticoagulant called heparin. So, as the histamine are released due to exposure to the pollutants, allergens, the inflammatory reactions takes place. That is what the asthma. Now, if that is the condition, what is to be done? The treatment. The treatment is using antihistamine drugs. Antihistamine that are what's said to be the bronchodilators. Here, the narrowing of constriction of respiratory tract called parts named to be the bronchioles causing the asthma. So, bronchodilators in the sense that expand. When a part which is narrowed, when become dilated, the breathing continues and one resumes the breathing. That's the reason why bronchodilators are used regularly by the asthma patients. That includes the antihistamine drugs. That is the point to remember. So, the disorder, chronic obstructive pulmonary disorder, it is due to the inflammation in the bronchi and bronchioles. It is due to the spasm, make a note. Spasm in the sense the sustained contraction of smooth muscles. So, the sustained contraction of smooth muscles of the bronchi and bronchioles what causes the inflammation, that is the asthma. And it results in the symptoms such as cough, difficulty in breathing, wheezing. Not only this, due to the inflammatory factors, due to exposure to allergens, also the asthma is caused where the histamines are all what accumulated in the bronchi and bronchiole make it closure. So one faces the same problem either by sustained contraction of the smooth muscle or else accumulation of histamine. Accumulation of histamine is the inflammatory mediators. Both are results in the asthma, and the treatment that is done for it is none other than using bronchodilators. Bronchodilators, nothing but the antihistamine drugs. Clear? So that's all what the asthma. Let's come to the discussion. The second one named to be the emphysema. Emphysema is also chronic obstructive pulmonary disorder. Emphysema is a status. Emphysema is a chronic obstructive disorder. Emphysema. The condition, the chronic obstructive disorder where the alveoli of lungs are what folded and damaged results in the fibrous and less elastic condition of the alveoli. Alveoli are elastic in nature. The elasticity of the lungs what decreases. Automatically the surface area of lungs decrease. So one faces the difficulty in breathing. I repeat, emphysema in the sense one of chronic obstructive pulmonary disorder where alveoli of lungs are damaged, soles folded, results in decreased surface area. At the same time, emphysema also shows the larger lungs become larger, less elastic and more fibrous. What do you mean by this? It means the connective tissue fibers are accumulated in the alveoli of lungs. So they become larger and less elastic. That is emphysema. The main reason for emphysema is none other than cigarette smoking. Cigarette smoking is the main reason for emphysema. Even it is said that the deficiency of alpha-1 antitrypsin deficiency what causes the emphysema. That is the reason why the biotechnologically produced alpha-1 antitrypsin is what given as the one of the treatments in the case of the emphysema. So, emphyse in the sense full of air. Full of air in the sense when air enters, it is failed to exchange. The surface area, if is more, the exchange of gases takes place. So the lungs remain full of air. So that is all about the emphysema. Emphysema literally means, the term meaning is inflation, full of air. Why? As the alveoli of lungs are what? Damaged, folded, results in decreased surface area. Alveoli of lungs are, the alveoli are 300 million in number. They are the sites of, actual site of exchange of gases. When they are decreased, naturally the surface area decreases. As it decreases, so the disorder what seen, that is full of air. And the other symptoms, the difficulty in breathing, besides that lungs become larger, less elastic and more fibrous. Particularly the cigarette smoking, which contain carbon monoxide. So that is the main reason for the emphysema. So the fibers are connective tissue which produces the fibers, collagen, elastic fibers, reticular fibers. These connective tissue fibers are accumulated in the lungs, leading to emphysema. The third one is named to be the bronchitis. Bronchitis is also one of the chronic obstructive pulmonary disorder. Bronchitis is nothing but, generally the diameter of the bronchi what decreases. The due reason is, we know very well, bronchi are with the goblet cells that produce the mucus. So more mucus is produced, which make the lumen of the bronchi narrower. Look at here. This is a normal bronchi. And see, this is another, the status of the bronchi. Look at here. Here all mucus is accumulated. This is the mucus. Mucus production more make the lumen of the bronchi narrow. The different status you find here, either by smooth muscles contraction what makes the lumen narrow, or else the histamine what make it narrow. But the different condition here, what condition here you see, the mucus production will be more, makes the bronchi thick mucus, that is the phlegm or yellow. Certain times you might have experienced when you keep, when you after the brushing, when you apply the fingers in mouth, immediately what you see is a yellow colored sputum, thick phlegm, yellow colored mucus you experience. Why? It is one of the mucus accumulation in the bronchi what makes the thick and the yellow colored mucus accumulation in the bronchi is all what name it to be the bronchitis. This is also due to the cigarette smoking, and it increases the condition. That's what bronchitis. So these three are what referred to be the chronic obstructive. Means for a long period, if they, that is their body is sensitive and they're prone for the condition. I repeat, chronic obstructive pulmonary disorders. They are of asthma, emphysema and bronchitis. This is due to the constriction of the smooth muscles, the contraction, constriction narrowing. How? The contraction of the smooth muscles, spasm of smooth muscles make it narrow, or else the histamine. That's the reason why antihistamine drugs are used. Symptoms are cough, difficulty in breathing and wheezing. Emphysema literally means emphysema in the sense inflation, or else the full of air. It is the cigarette smoking individual more prone for the emphysema, where the alveoli of lungs are what damaged. Alveoli of lungs are damaged due to folded nature. And this makes the decreased surface area of lungs. And also we see lungs become larger, less elastic and more fibrous. Third one, bronchitis. The mucus production makes the bronchi thickened. Its lumen become narrow, and that is the bronchitis. And they produce more thick and yellow colored phlegm or the mucus, thick mucus, which is named to be the phlegm or sputum. Thick yellow colored mucus is named to be the phlegm or the sputum. That is what the bronchitis we see. Besides that, the other disorders we come to discuss is none other than pneumonia, tuberculosis, diphtheria, SARS, cyanosis. These are all what we came across, and now we'll see that. Pneumonia in the sense, it is a non-COPD. It's not a chronic obstructive pulmonary disorder. That is, it is an infectious. That is either bacteria, virus or a protozoan may cause this condition. So 2 points to remember. That is the chronic obstructive where the pathogens are not involved. One prone for regularly to the allergens, that is maybe pollutants also. Here, if infection takes place by pathogen named to be the Haemophilus, that is a bacterium, Streptococcus pneumoniae. Streptococcus pneumoniae bacteria, what causes pneumonia? We have discussed in the first year. Streptococcus pneumonia causes the pneumonia, and it is what with the symptoms, the alveoli of lungs are filled with the fluid. That's what the pneumonia. It may be the bacterial virus, or else certain times the protozoans may cause this pneumonia. So in this connection, if the infections what aggravated, it leads to death. But in the chronic emphysema, which lasts for a long period, but this is for short period, that's what it is said to be the non-COPD. It is not comes under chronic obstructive pulmonary disorder, pneumonia. And naturally, the symptoms are difficult in breathing, sneezing, snorting, and besides that, the alveoli of lungs are filled with the fluid, is what we see is a pneumonia. Besides that, tuberculosis, TB also related with the respiratory disorder. Here we discuss, it is caused by means of Mycoplasma tuberculosis. What causes the TB? Tuberculosis. And according to WHO, large number, about 10 lakhs of people are prone for this disease per year. India is also noticing, India is also facing the same threat. And this Mycoplasma tuberculosis is a bacterium which even survive at the air for a short period. So it is the more dangerous, which is also shows the symptoms. One prone for the breathing problem, cough, and even fatigue, sweat during the night time. Particularly, these are the symptoms. If one prone for the cough for over more than 4 weeks, one has to be tested. However, the cough may be due to other effect also, but for a care, one has to take the diagnosis. Generally, the tuberculosis is what showing the symptoms as just now I told you, fatigue. Fatigue means one prone for the tiredness, immediately tiredness, continuous cough, breathing problems, and also profuse sweating at the night time. If it is observed and for a prolonged period, if the cough, that can be the TB. Next, the common cold. Cold is caused by means of a rhino group of virus. Generally, this cold, treated or untreated, it lasts for 7 days or 1 week. Both are same. With that we have learned in first year. And the incubation period lasts for up to 7 days. Even if treated or else untreated, it lasts for 7 days. Rhino group of virus. It spreads in a faster manner through contact, through the touch with different devices. Pen, pencil. If in a classroom, if a child suffers from the cold, it immediately spread to others.